Hello everyone, this is Dr.Shanjeetha. Today we are going to talk about fever. Like many mothers, they used to ask me, my kid is having fever, what am I supposed to do? How am I supposed to overcome this condition? Even after giving paracetamol or Panadol syrups, it's not getting settled. And why my kid is always getting fever, and so many questions I used to get. So now let's go through over the fever. Like, what is a fever? Fever is a natural response for any infections that get into our body. It's actually a self-defense mechanism. Whenever the pathogens like bacteria, fungi, viruses, they get inside the body stimulates our immune cells like white blood cells, and they produce kind of chemicals called pyrogens, and they go and binds with the receptors in the hypothalamus in the brain, and they activates the temperature, and they kind of started to rise up, and that's what we all feel. My baby's body temperature is rise up and my baby is having fever. First of all, there are so many factors that also can influence in the rise of the body temperature, like you are working out a lot and you are walking under super sunny. So many things can influence in the rise of temperature. For us to get to know what is a fever, first we have to get to know what is the normal body's temperature. So it's around 96.8 to 100.3, and anything above 100.4 degree, that's called as a fever. This fever also varies according to the age in the children. So if your fever gets, you have to wait at least for 24 hours at home, giving the exact dose of the paracetamol or the Panadol syrup. And even with the exact dose, if the fever doesn't get settled, you have to reach for a doctor for further evaluations, which you can't do at the home level. At home level, to get over the fever, you can just do tepid sponging, and you can just apply cold water. In the sense, it will be in a thin layer, not the whole bulk of water. And you can turn on the cooler system, and you can reduce the dress amount the kid is wearing. Like that you can do at home level. But even if the fever doesn't get settled for 24 hours, it's must for you to get the doctor's help. You're supposed to seek for help to find out the root cause for the fever. And because there are so many factors that play a role in fever mechanism. Like it can be just a simple viral fever, or it can be associated with neurological stuffs also. So that those are like so vitals. And the most red flag for the kids having fever, it's always the febrile convulsion. Normally the kids are so prone to get febrile convulsion. With the fever, they will be getting the fit. So anytime your kid is having fever at home level, try to reduce the fever by giving the exact dose of paracetamol or Panadol dose. That also would be prescribed by a doctor or a medical profession, because that goes milligrams per kg. So if even though your kid is like 3 years or 4 years, if the kid's weight is huge, that appropriate to the 5 years of kid, then you can't give a 3 years old dose. So the medication should be prescribed according to the body's weight.